you're messing with nature.
Nature messed with me. I don't have any problem messing with nature. That's absolutely true. I'm messing with nature. But that's what people do. We redirect water. We call it plumbing. You know, that's not natural.
The Night Side continues with Barb DiGiulio on Newstalk 1010.
Welcome back to the show. It's 9:08. That was Cindy Jackson. She's in the Guinness Book of World Records for the most surgeries, most cosmetic procedures. And, you know, we've been hearing a lot about cosmetic surgery in the news lately. The latest I've seen is that Rumer Willis, the daughter of Bruce Willis and Demi Moore, is saying that she wanted cosmetic surgery for many, many years because she was bullied so badly. So we're going to be talking this half hour about whether or not changing how you look on the outside helps how you feel on the inside. And joining me right now is Dr. Stephen Mulholland. He's a Toronto cosmetic plastic surgeon from SpaMedica. Dr. Mulholland, welcome to the show.
Oh, thanks for having me again. How are you?
Wonderful. Thank you. And first question, when people come to you to have any procedures done, does it ever enter the conversation as to why they're doing it?
Oh, almost always. I mean, it's very, very important to recognize that as all certified plastic surgeons do realize that about 15% of all of our patients, 15%, a shocking number, suffer from true body dysmorphic syndrome, where no matter how many procedures you do, they can't be happy. A certain percentage are depressed or are out of a recent bereavement relationship issue, and you really can't solve emotional and psychological problems with cosmetic surgery. And so a good plastic surgeon will be able to, through a thorough history and physical, just counsel a patient that perhaps it's time to maybe visit their family doctor first, get some psychological counseling, feel better about life, because cosmetic surgery should be an embellishment and icing on the cake. It's not building the cake itself.
That's really interesting, and it makes me wonder, have you ever had to turn people away?
All the time. And you know, professionally, you need to say that perhaps, ma'am, this is not the right time in your life. You've just been through a divorce. You're not feeling positive about life, or you've had a loss in the family, or you've suffered from depression, or you've been ridiculed about a body part. It's important to feel positive about who you are sort of cognitively before you change anything physically, because going through cosmetic surgery is stressful. It takes a strong psychological resolve. There's pain and recovery, and people have to be very sound and strong to undergo cosmetic surgery. You know, in the final analysis, you say, well, why does anyone do it? Because in the ideal world, we'd all, you know, go boldly forward with our strong brains and our big minds and big hearts and be accepted for who we are. But realistically, we live in a very vain culture, and most well-adjusted and successful people realize, I got to probably do my hair, I got to wear nice clothes, I've got to present myself because the book is judged by the cover. But I don't think that you should be a book without content, and that's the difference.
What are some of the things that you look for in terms of somebody's mental state when they're coming to you to talk about getting a procedure done? Are there certain red flags that you look for?
Oh, all the time, sure. So if they're on antidepressants, most plastic surgeons, certainly myself, will ensure that I get a letter from their primary therapist that they feel that they're stable and can handle the stress of surgery. If they're on anxiolytics or anxiety medication, if they've had a recent loss in the family, a death of a close one, or if they've had a relational breakup, if you get a sense that that they have had multiple procedures in a short period of time, or if they're over concerned about very small things, because the vast majority of plastic surgery patients are quite obsessive compulsive, and having an obsessive compulsive trait often makes you very successful. But when you have a sprinkle of perfectionism and can never be happy unless it's perfect, those patients need to be often turned away and cautioned, because we never have perfect outcomes after Botox or even fillers or facelifts. And yeah, you can have a very nice, good result, but you'll always find some faults. And so people that can't be content with just looking pretty good generally need to be turned down.
We're with Dr. Stephen Mulholland, a Toronto plastic surgeon, and we are talking about whether or not changing how you look on the outside helps how you feel on the inside. Does that ever happen? Does somebody, one minor thing, or they're not crazy about their nose, or they're not crazy about, their face is starting to sag, can a procedure really help with their self-esteem?
Well, there's no question, and unfortunately the answer is yes. And so let's say we go through that checklist of all the things that you might caution a patient about proceeding. But let's just say that, like everybody, we have our weaknesses and our strengths, and we have our insecurities about certain physical things, post-pregnancy, post-weight loss, or hereditary development, or trauma, or a hockey puck to the face. And you have a procedure done. It can be a small thing like Botox or a facial, or just the way your makeup rides, or a soft tissue injectable, or a breast augment after breastfeeding, and suddenly you know that you look better, and you've done it for yourself, and there's just a little more spring in your step. You feel just a little better about life, because we live in a culture that's quite vain, and we know that. We like to look good, and to look good is to feel good. And thank God there's many, many people that can feel good without having to look look awesome. But there's many, many, many people that just feel really good about changing an annoying body part that, for no fault of their own, through having children or aging or hereditary combination of bad genetic code and DNA, got something they didn't want, and a little fix. And it doesn't mean they're pathologically depressed or insecure. They just feel better about and more balanced about their body or their face. And it's the best decision they ever made. Those are the best kind of plastic surgery patients. What
are the most common procedures that you're doing now for both men and women?
Well, you would divide that into the non-surgical and surgical. Non-surgical, by far, last year there was about $10 billion spent worldwide on cosmetic plastic surgery. And if you look at the spread, it was 82% was non-surgical, about 18% surgical. For non-surgical, Botox, number one, soft tissue fillers like Restylane and Juvederm, and then, photofacial, laser hair removal, fractional skin tightening, radiofrequency tightening, non-invasive fat killing, and we can freeze fat now and kill it. So the cool thing about doing cosmetic plastic surgery is the vast majority of it, 82%, is not even risky. It's well, it's risky in that, you don't want to get carried away, but it's non-surgical, so you don't, risk life and limb. 18% is surgical. If you look at women for surgery, still number one is liposuction. Number two is breast augmentation. Number three is rhinoplasty. Guys are getting to the act more and more. About 20% of my patients now are men. And that will be laser hair removal of the back or the chest. And then liposuction of the love handles or the 50-year-old male boobies and double chins. And for guys, those heavy bags, those tired-looking bags under the eyes.
Wow. So it runs the gamut, and it sounds like with the non-invasive stuff that it's suddenly become more accessible to people, and maybe it's easier to do things than it was before.
Oh, so much so. I mean, a lot of women, and you probably have friends like that, they view the non-surgical plastic surgery treatments as an extension of hair care, nail care, and skin care. So,
right.
Yeah, of course I'll do a little Botox. Don't be excessive. A little bit of filler where I have some lines and wrinkles. And, of course, I'll do some laser treatments to keep my skin looking good. And, I don't want to have to shaving stubble in the summer, so I'll do some laser hair removal. So that's become an extension, I think, of just basic personal hygiene. The surgery is still a big decision, and to undergo surgery is it needs to be someone who's of sound mind and willing to accept risk and has reasonable expectations. And that's our job as plastic surgeons, to make sure the expectations are reasonable and the mental status of the patient is sound.
Dr. Stephen Mulholland, thank you so much for this.
Thank you again.
Dr. Stephen Mulholland, Toronto plastic surgeon with SpaMedica.